Hi, my name is Deborah Wright. I am the chairperson for the Brooklyn Family Support Service Advisory Council. I am also the Brooklyn statewide representative to the statewide advisory council. I welcome everybody, but I also want to thank my two counterparts. First, I want to thank Tina Vale from the Bronx. She is the chairperson of the Bronx Family Support Service Advisory Council, as well as she's the Bronx representative to the statewide. And in Queens, I want to thank Aliyah Hussein, who is the chairperson of the Queens Family Support Service Advisory Council, and as well as the Queens member to the statewide advisory council. And we all welcome you. We are grateful, and we thank the Mayor's Office for Community Affairs, Ms. Maria Mark, for agreeing to help us hold this town hall, as we have so many questions that need to be answered. And even though, yes, OPWD does their major outreaches, we still live in New York City. So by knowing what the Mayor's Office for Community Affairs is requesting of everyone and how we can both work together is very important. So with that, Christopher, let's see if my other counterparts have other things to say too.
Let's get to our next borough, going all the way up to the borough number 2.
Over the Whitestone.
No, we didn't go over the Whitestone yet. We're still in the Bronx, so we're heading into the Bronx. Tina
the
from the
Whitestone.
Bronx.
Well, hello, everybody. I'm just thankful that everybody's here. Deborah did a great introduction, so thank you for attending, and I hope you get the good information that you need that Ms. Mark's going to give us this evening.
And thank you, Tina. So good to see you through the computer.
Yeah, I'm here.
Yeah, she's here.
I'm glad.
And going over the Whitestone Bridge, Leah.
How are you, Aaliyah?
I know I see her because look at her. She's like, looks like she's up in the sky. It's the birds are playing. No, it's Aaliyah.
Yeah, I got a new stand, so I have to enjoy that.
Yeah.
Good evening, everyone. Thank you so much for taking out your precious time. And Deborah has really introduced us so well. Yes, we are the chairs of the council. I'm from Queens, and as well as on the statewide. I hope you enjoy and hope the session would be informative. Thank you so much, Chris and Deborah, for arranging this. Thank you.
You're welcome, and it's our pleasure, Aaliyah.
And Aaliyah, you're really going to enjoy. So all I'm going to say to everyone, mute yourself, have a paper and pen, look at this. This is going to be fascinating. Am I right, Tina from the Bronx? Well,
absolutely.
Yes, thank you. And now,
I'm sorry I was on mute. Thank you, everyone. You're going to enjoy it.
Hey, at least we're getting a good sense of humor in the evening. We got to get some good energy in there.
Right.
And now let's introduce, yes, she is the same age as all 3 female advisory councils. And yes, she is a superhero because I said this early this morning, and Tina can vouch with me as well as Debbie.
That's right.
She is a Wonder Woman, but she works with our population, the best of the best. And I can tell you, she's going to kill me later, which I don't care.
That's right. I'll help her.
Maria Mark, Senior Community Liaison for the Mayor's Office of Community Affairs. Maria, are you there?
I am. Hello, everybody.
And look, she's so fancy tonight. Oh.
Wait, you're wearing, I see you put your glasses on today.
I've had my glasses on for a while, but in 2 weeks, I'm never going to have them ever again, hopefully. But I have them now. And I just want to thank Chris, Debbie, Tina, and Aaliyah so much for allowing me to speak to all of you today. I'm very excited for this presentation. I know we did this a little bit earlier on today, but I'm still very excited because we've got a number of participants. I'm sure that some of the questions that you have are going to be very interesting. I actually have some updates from this morning. We were kind of quick when it comes to a lot of these things. So if, without further ado, if I can share my screen.
Now that's my magic plan now. Now it's time for Maria to dance now.
All right. So we're gonna go through this. So as everybody and their mother has said, literally, my name is Maria Mark. I'm from the Mayor's Community Affairs Unit, and I'm going to give some COVID-19 updates. The first thing, which is the most important, is all of this information is changing at all times. One, because there are a lot of things that we may not know about the virus. Two, is because some of the information that is on this presentation is current as of today, but 2 weeks ago it was different. At the beginning of last week it was different, and in 2 weeks it's going to be different. So this is something that that we know right now, but it doesn't mean that that's always going to be the case. I want to share the first thing is the current cluster map. This is as of last Thursday. As you can see, there are parts of Queens and Brooklyn that are in yellow and parts of Brooklyn that are in red. I want to explain what that is today, but this is just a general overview. 2 weeks ago, this map looked very different. There were orange parts in both boroughs. There was red in Queens, and there were parts of Queens that were not yellow. So South Ozone Park is now yellow. So just so that you know, these maps are changing. It's based on the number of cases that are reported when there are tests, so positive test results. And the governor has a formula, and he comes up with specifically what all of these mean. How do you find your zone? That's the most important question when it comes to clusters, because you want to understand what, where you live, where you work, where you go to school, and where you worship, or if you're going to be going to some kind of gathering, what your zone is. So the way that you're going to find your zone, very simple website, right in front of the screen, nyc.gov/COVID zone. What that website is, and I'm going to do a demonstration at the end of the presentation, is you put in an address, it tells you what your zone is, and it also tells you what that means. I'm now going to go through exactly what that means, starting with the red zone. And so this is a little bit more in depth than what you would see online, but generally you'll understand online what all these zones mean. Right now, since we only have red and yellow, that's what I'm going to focus on. Although in a few days, these areas may change. You know, in 2 weeks, it may all be red, it may all be yellow, it may all be nothing. I hope that it's nothing. That is the goal. And so right now we'll go through what that means, and I'll also explain how you can find information if this changes. So in a red zones, all schools are closed. That's public and private. All non-essential businesses are closed. In order to find out whether a business is essential, you can check at the governor's state empire, the New York State Empire State Development Corporation. There are links, and I'll show everybody again at the end how to find a lot of this information. And so over there, you know, most non-essential businesses that we're thinking about are medical offices, grocery stores, things like that. So that's what is considered essential, and so non-essential would be different things like gyms and hair salons and some clothing stores. For food services in a red zone, if you're a food establishment, you can do takeout and delivery, the same as in the beginning of the pandemic. There is no indoor or outdoor dining in this red zone. Houses of worship, they can remain open, but only 25% capacity up to 10 people. So if you've got a very large house of worship, whether it's a church, a shul, a mosque, a temple, anything, if you've got a normal capacity of, let's say, 500 people, or let's say 200 people, it doesn't mean you can allow 50 people to be in. It means you can go up to 10. And for gatherings, there are absolutely no non-essential gatherings allowed of any size in the red zones. And if you are caught promoting or organizing a mass gathering, that can be, you know, 15 people, that could be 100 people, it could be 300 people, because there is a very strict prohibition on non-essential gatherings. The fine is $15,000 a day. That's not $1,500, that's $15,000 per day. So that's a very steep fine. We want to prevent people from gathering, especially in areas where we're seeing a lot of spikes. in a yellow zone, I'm skipping over the orange because we don't currently have orange zones, but in a yellow zone, all schools are allowed to be open, both private and public. The only difference is that in yellow zones, as opposed to in a no zone, which is parts of Brooklyn and Queens and all of the Bronx, Manhattan, and Staten Island, in those yellow zones, there is a requirement that for at least 20% of students, staff, and teachers have to be tested weekly. All parents must give consent in order for their kids to be tested. If you feel uncomfortable with having your child tested, you don't have to give consent, and that will mean that they don't have to put it in for a test. But that's what the requirements are for schools. For businesses, all businesses can remain open. They just have to follow COVID-19 requirements, which is the social distancing, face masks, all of those things, cleaning logs, temperature checks of employees, same as in an area without a zone. Food establishments can do both indoor and outdoor dining. The same requirements are for in a no zone as in a yellow zone. The only difference is in a yellow zone, you can do only up to 4 people per table. So that's a big difference than in other parts of the city that don't have a zone, because in those areas you can have 20 people at a table as long as that restaurant, you're under the 25% capacity for indoor dining, and for outdoor dining as long as they're social distancing. Houses of worship have no change than the rest of the city, which is 50% max capacity. And for gatherings, the limit is 25 people max for non-essential gatherings, and the fine is still the same, $15,000 per day. And so that is, again, very steep fine because we're very, very serious about this. For the yellow zones, big difference are schools are closed like in the red zones. Some businesses are open. It's just gyms and personal care places like barbershops and hair salons and nail salons are closed. Food establishment can't do the indoor seating, but they can do outdoor, max of 4 people. House of worship is up to, instead of 50% or 25%, it's 33% capacity, but up to 25 people. And for gatherings, no more than 10 people. So now that we're here and we're currently seeing a lot of spikes in different parts of our city, we need to make sure that we can stop the spikes. So this slide is something that everyone should be extremely familiar with. This is the kind of information we've been talking about since pretty much day one. If you're sick, stay home. Even if you're not sick, you always want to keep that physical 6 feet or more distance from each other. Keep your hands clean, wash, 20 seconds at minimum with soap and water. And if you don't have soap and water readily accessible, just as Chris is showing, I'm not sure if everybody can see the screen, but that would be the hand sanitizer. So please use hand sanitizer when soap and water is not available. And then wear a face covering. So face covering is extremely important. I know that we've been talking about this till we're blue in the face, but those are the core 4, and that's something that has not changed since the beginning. We feel like these 4 things will help. The next thing is, in addition to doing all these 4 things, you want to get tested. I'm going to talk to you a little bit about the Test, Trace, and Take Care program, and that's from Health and Hospitals. And so the first thing about that is the testing part. All tests that the city does are absolutely free. You do not have to have insurance. You do not have to have citizenship. You do not have to have, any kind of forms of ID to go and get tested. And the easiest website, or one of the easiest websites that the city has, nyc.gov/COVID test. And all the links are going to be at the end as well. So this COVID test link is going to tell you not only where we have a not only where we have the testing sites that are permanent, but every week on Mondays, there are new testing sites that are mobile, and they're all over the place. Right now, we have one in the Bronx. We have a number in the cluster zones in Queens and in Brooklyn. We've got 2 in Staten Island. It's only Manhattan that doesn't have one at this point, but they have other facilities that are mobile units that are available. Again, you can check on this website. And just very briefly, who should get tested? Everyone. Get tested often. If you are feeling like you have signs of COVID, get tested. If you are concerned of a possible exposure, get tested. If you've been in a very large group of people and you don't know who those people are, get tested. If you work in a setting that is that has a lot of housing, so nursing homes, shelters, things like that, get tested. And if you're going to visit someone who's high risk, or that you yourself are high risk and you're concerned, please, please, please get tested. Test, again, free. Immigration status not asked, insurance not required. And when it does come to the immigration question, there are people who are concerned. They want to get their green cards, they want to get their citizenship, they're concerned about public charge. Fortunately, COVID-19 testing and treatment is not subject to public charge, which means that you are not going to be penalized to try to get help. Why do we want you to get tested? That is going to go into the next part, which is the TRACE program. If you are tested negative, and I've been tested negative quite a few times, so I can speak personally about this. I go to an H&H site, sometimes mobile, sometimes clinic, and I get the test done. And I've gotten the rapid test, I've gotten the regular test, I've gotten the short swab, I've gotten the long swab. I haven't gotten the antibody test, that's the only one that I haven't gotten, but everything else I have. And for all those tests, afterwards, I can log on after a few days to My Charts, which is instructions that they will give you from H&H if you're getting it at their site. But even if you're not getting it at their an H&H site, but you're still getting it at a location that's partnered with the city, for example, a CityMD, or quite a number of other locations throughout the city, different urgent cares, things like that. They're gonna give you a call and you're going to be told that you are negative. Once you get that call, that's the end of your interaction with the H&H folks and the test and trace team until you're gonna get tested again. Which again, you should do often, especially if you feel like you've been exposed or you are in a situation where you're going to see someone who's more at risk. Now, let's say that unfortunately you've gotten tested and the result is that you're positive for COVID-19. Here comes the TRACE part of the program. The TRACE part identifies cases and contacts. And the big difference between cases and contacts is a case is a person who has already gotten COVID-19. They've tested positive for it. That's considered a case. A contact is the people that are close to them that may not have tested positive themselves, but have been in a situation, whether they're living together or they, work very closely together, that during that point, that window of time where that person could have infected them, they would become that close contact. So when a test and tracer or a tracer calls you up, what you want to do is, first of all, you want to answer their questions and you want to answer them as honestly and as thoroughly as possible. You're not going to get in trouble for, attending something that maybe you shouldn't have gone to. You're not going to get, that is not the goal. You're not going to get in trouble for going into a business that maybe should not have been operating. Their goal for the tracers is very specific. Their goal is to make sure that they understand who you've come into contact with. And so they're going to give you a call, you're going to share your information, and then they're going to tell you a few different things. First, they're going to tell you what COVID-19 is all about. They're going to explain your diagnosis. They're going to monitor you every day for new or worsening illness. Hopefully, you will remain asymptomatic. That is definitely the hope, but that doesn't mean that you're not contagious. They're going to identify your contacts, as I had said. They're going to recommend and support you in isolation. They're going to, and this is going to go into that last part, the take care part. They're going to evaluate your needs for supportive services. That means hotel, food, laundry, medication deliveries, things of that sort. And then they're going to let you know when you can leave isolation. When they have a case, because that person has already tested positive, that means that they may have been sick for a number of days. You would not test positive if you haven't been sick for at least one day, because it takes a while for all of this. So in the case of people who have tested positive, you are in isolation for 10 days. So that is the date. When it comes to your contacts may not necessarily have tested positive for anything, either because they didn't have it or just it has not shown up at that point. So for contacts, that's a 14-day isolation. What happens when a tracer contacts you is, first, they're going to educate you about COVID-19 and the exposure. Second, they're going to monitor you daily for new or worsening illness. That's the same as the other as cases. They're going to recommend and support you in quarantine, evaluate your needs, and let you know when you can leave quarantine. Again, that's 14 days. If at some point you do take a COVID test and you are tested positive, which is highly, highly, highly recommended that you do take that test, and then you quarantine at that, like after that test. What they're going to let you know is, what your status is. If you test negative, you still have to quarantine. If you test positive, they're going to go through that process with you. This is something that's very important that I'm going to ask everyone who's on the call right now and anybody who's watching. When you go get tested, you have to leave your phone number with the whether it's the H&H locations or with your own personal doctor or anywhere that you're getting tested. And you're going to, if you do get tested positive, you're going to get a call. If you're going to get tested negative, you're still going to get a call, as I had said, but from the positive test is very important as well. The numbers that people might see, or the caller ID that you might see, is NYC Test and Trace may pop up on the phone for caller ID. The numbers start with 212540 or 212242. And I know that we're used to so many calls that are spam calls, that are scams. But please, if you do see these phone numbers, please let everybody know that they should answer those calls. If you miss it, check your voicemail. They will leave a voicemail as well. And please answer the contact tracers questions honestly and accurately. We want to make sure everybody in the city is safe. Make sure your healthcare provider has your current contact numbers. And so if you're getting a test at your own personal doctor's office, and it tests positive, they have to report to the test and trace program, and contact tracer will reach out to you that way. And if you think you were exposed and you have not been called by a tracer, you can still get tested for COVID-19. This is very important. I've had a situation where someone had called me on 2 different occasions. My friends, co-workers actually, that had called and said, hey, we were at an event yesterday together. We were there all day together. I'm not feeling so well today. Please go get tested. And I have. And luckily everybody came out negative and none of us had any issues or any complications. But just in case, it turned out to be a cold, you still don't want to catch cold, but that's something that's very, very important. So please don't wait for a tracer to call you to get tested. The last part, I kind of hinted at this in the last part of the step 2, which was the trace. It's a take care. The city is here to make sure that not only do you know your status and that you isolate, but also to make sure you have services. So you've got two options. First is you stay at home. That goal, keep New Yorkers isolated in their homes and safe. They're going to make sure a resource navigator will help you with different things. Do you need food? Do you need mental health resources, medical care? Do you need help accessing your medicine, even if it's not COVID related? You get heart pills and your prescription is up this week, but you're home isolated. So they're going to make sure that those services are there for you. They will have a resource call you back within resource navigator call you back within 24 hours, and they're going to find out, if this is something that you need. So those tracers are going to absolutely make sure that you have the things that you need. The second option is the hotel program. So if you're living in a space that has a number of people, especially people that are either sick or that have other pre-existing health conditions that would make them more sustainable or more at risk to get any kind of diseases, especially COVID-19, what the hotel program does is actually allows you to be separated from those people. There are free hotel rooms. You can bring your dependents. So if you and your child both get sick and you've got an elderly grandparent at home, you're not leaving your child at home. You're going to take your child to the hotel with you. So you can do that. The stay is from 10 to 14 days. And this is to make sure that if you are already tested positive, it's that 10-day stay. If you're just a contact, then it's that 14-day stay. And so, again, for anyone who has COVID-19 or those symptoms or contact, you don't need to have been tested to qualify. You can get tested at the hotel. Dependents can stay with you, as I had said, whether they're children or elderly. If you have elderly people in your household that have gotten sick, but now you have kids at home that are still safe and you have another adult that can stay with them, then you and the other person could come in. 3 free meals a day, Wi-Fi, cable TV, free transportation to the hotel and home upon discharge. Nurses are on site 24 hours a day, 7 days a week. This is a true isolation quarantine. You cannot come in and out. You cannot have anybody come to visit you. And then that is one of the other big programs that are available to anyone who unfortunately gets sick or is a contact. The last thing I just want to follow up with this is these are 3 links. They're a lot simpler than I had this morning. I'm going to go through these links. And so this is talking about everything that I've spoken about earlier before. So I'm going to go through some of these. Okay, hang on. All right, so we have, just bear with me one moment. And I shall, here we go. All right, so, okay. Okay, so here are the 3 links that I talked to you about. The first one is the nyc.gov/COVID zone. This is the map that you had seen earlier today. And what you do is right over here, you're going to put an address. So we're going to try out 3 addresses for 3 different locations. 1, 2, 3, 4 Avenue S. That's going to be in Brooklyn. And that comes up. You're going to get a close-up of the map. The area is, as it's listed, a red zone. And then it gives you a breakdown of what that means. It means houses of worship for gatherings, businesses, dining, and schools. That's the restrictions. Now let's say I want to try a different location. Oh no, I guessed wrong. Let's see if that's even a location. Nope, I'm not doing so well with guessing these. Let's try. All right, let's try this one. So this one is in a yellow zone. So now you see that the activity guidance is a little bit different. And so that's what we see. And again, you see this. And now let's try a Manhattan address, 253 Broadway. All right. So let's say you get this. This is not an error. It says you are not currently located in a designated hotspot. So COVID-19 is still spreading. To find out more, and then it gives you a link, and that's going to be the next link that we actually talk about. And so I'll click that, but that's pretty much how you find your zone and what that means. So the link that I clicked right now, which can also be found when you go to nyc.gov/health, and then you can just click on COVID. Both get you to the same place. This is a lot of information. The top gray box is usually the most up, or the information that has changed most recently. So Halloween safety, you're not really going to see this in 2 months, and you didn't see this 2 months ago, but it has that. School and non-essential business closures, that's what the clusters that we were talking about. Over here, it's what you need to know about NYC's localized restrictions, available in multiple languages. And you click there, and this is that slide that I had. And this one also includes what the orange zone means, so you can take a look at that. And on the bottom is all zones, which is essentially that 4-4, stay home, physical distance, wear a face mask, wash your hands, and get tested. The other thing over here is if you're looking at specific restrictions in one of these zones by facility type, because you might have a very niche job that you don't know if it should be closed, or a business or a house of worship. This has everything, red zone restrictions, and then they go into a lot of things, orange zone restrictions, and so on and so forth. And one of the beautiful things about the site is it is available in multiple languages that you can click right on top. So if you don't understand English, or you read in a different language better and feel more comfortable, you have that option. Over here, you'll find everything from symptoms and what to do to get sick, to data, to guidance for businesses and schools, and information for providers. And one of the best parts are the posters and flyers. The posters and flyers, again, multiple languages, and lots and lots and lots of posters. And we're not going to go through all of them, but if you ever want to post something on social media, or you need any of this information, it's right here for you. And the last thing I wanted to go through is the testing sites. That's nyc.gov/COVID-test. When you go here, you are going to see a few things. One is you're going to see right over here, where can I get tested? There is a list of different ones for this week. They tell you available, subject to change due to inclement weather. You know, if we're going to have a rainstorm, they're going to have to shut down, whether for a few hours or for the whole day, depending on the weather. But they are Monday through Friday from 10 to 4. This list does change, and it changes weekly. Sometimes some of these locations have been on for a number of weeks. It's because they're in problematic areas, perhaps in a lot of red zones and yellow zones. And then you can go to the bottom, just in case none of those are convenient for you. You can put in your address right here, and then you'll be able to find a COVID testing site that's right next to you. Some of them can be H&H sites. Some of them are other sites like City MDs or other urgent cares. And so that's kind of for that part, what that is. And I just want to go back to my slides. I want to make sure that everybody does see these 3 websites. They're very, very important for the COVID, you know, how do we do this? So whether you have to know your zone, where to get tested, or just everything that you might need to know about COVID, these are 3 wonderful websites. I'm going to end this presentation right now. I want to thank, again, everybody that is here listening. I want to thank Chris and Debbie, Tina, and
Aaliyah.
I'm so sorry, Aaliyah. I want to thank everyone here for for taking your time this evening. This is my email address. You can always send me an email. Before I take any questions, I wanted to very quickly talk about a question that was raised this morning about definitely there are concerns about how the children are treated at some of these testing sites and things like that. I have definitely flagged that for my team. And if anybody has specific locations where they have seen that children or any adults who may have disabilities or who may need accommodations, sometimes that's an elderly person who is using a walker or wheelchair, sometimes that's a child who may be autistic and has a sensitivity to sound, maybe that's something else. Whatever the situation is, if you're ever at a testing site or really at any city site that is not accommodating, please let me know. I can flag it for my team. If you have any specific locations, you don't have to talk about that here. You can send me an email. We as a city want to make sure that all of the people in the city, whether they're young or old, whether they're little kids, everybody feels comfortable in the city. And so it's very important when we hear about concerns that there are staff that may not be sensitive that to different needs, that may not understand that certain children and certain adults need certain accommodations. And it's very, very important that we address that and that we have sensitivity training, but also that cultural competency. And when I say that, I don't just mean for a specific nationality or a religion, but also for just the different accommodations that people need. I know that when I had flagged the concerns that there were children, unfortunately, that were being pretty much teased at sites, like don't be a baby or something like that. My team got very, very good about this. And so it's incredibly important for us to know if there are any kind of concerns. If you have locations, that would be excellent so we can make sure that they're addressed, but also on an overall level that the staff is aware of how to best accommodate the kids and the parents and the adults and the seniors who may need something additional. And now, if anybody has any questions.
Okay. Before we let everyone has questions, I'm going to ask Aaliyah and Tina, please unmute yourselves. Aaliyah, you don't need to raise your hand. Get off that.
Unmute, Aaliyah.
Okay.
Okay, Tina, are you unmuted too?
Because before, Leah,
Okay.
before you have your question, Leah, we want to say one thing that
We have to say something very
because you weren't
important.
there earlier. So
Okay, Tina and I both brought up the same issue that Maria did just address, because we all are parents, 3 of us are parents of children with developmental disabilities who are very sensitive, and our children may be adults physically and chronologically, but not developmentally the age. So I'm thanking Maria for addressing this. Tina, did she address it the way you felt that you were happy to hear?
Yes, I do think she did wonderful.
Thank you.
and Aaliyah,
Aaliyah, she did address our concerns. Do you have something you'd like to add? Or you have
Yes,
a question? We're thanking
I have,
Leah.
yeah,
We're thanking
yeah.
Maria first because she
Pardon?
immediately addressed.
Pardon?
All right, listen carefully. Tina and I brought up the issue of how our children, when they get tested, some of them can't use the swab of the nose, whether small.
Well, I was going to ask that question again for the other people that are not
Sure.
here.
But we're thanking Maria because she was addressing it and came back quicker than we both thought. So Tina and I first want to say,
But Maria, let me ask you this. I'm going to do it just because other people are here. Most of us have children that have disabilities and they may not be able to sit still for the swab.
Mhm.
So you was explaining to us earlier that there's a different way that we could take for them. And also I had mentioned the antibodies, I think, earlier too, which is what we had did for the children earlier, you know.
Absolutely. So in the beginning, there were these very long swabs. I've gotten that a few times, and it's not pleasant. And, you know, when you're an adult, it's not pleasant. When you're a kid, it's especially not pleasant. And so right now there are actually different swabs that are significantly shorter. I've gotten that as well. I definitely prefer that one, and I can understand how children may feel more comfortable because it's not something that goes all the way down. It's something that looks more like a Q-tip. So that is one of the options that is available. And when I had a rapid test as well as the diagnostic, the regular test, the last time, which was last week, I had the shorter swabs. And so that was significantly more comfortable, and I think that that could be a good option. But in addition to that, one of the things, especially when it comes to children, I have a small child and she's a toddler, and it's very difficult for us to test her. We have not yet done that, and I hope that we never have to. But we also understand that, like, me and my husband are always at home with her, and even when she's elsewhere, when she comes home, she's coming home with us tonight. So we test ourselves in order to help to figure out what her risks are. If the both of us are negative, there's a very high chance that she's also negative. Otherwise, she would have spread it to us. And so since we get tested fairly regularly, it's something that, you know, kind of means that, yes, maybe she's not getting tested, but at least we have somewhat of an idea, especially if, God forbid, either of us or both of us test positive and then she starts to have symptoms, then it's a good indication that she may have contracted the disease. But otherwise, that's one way. The antibody test, if you take the antibody test and then 3 months later you take another antibody test and they're still finding that, yes, you've tested positive both times, the city does consider that you have gotten the COVID-19 virus. The only thing is that it's very difficult to pinpoint when you've had it and if you currently have it. So if you've gotten the antibody test, it means you could have been contagious a month ago, could have been contagious a week ago, and so that makes it a little bit more difficult to pinpoint, but it is another option, at least knowing what your status is. But again, they test it. If you've tested positive and then in 3 months you test positive again, they do consider that a case.
Maria, one more question. I'm sorry. We talked about the short swab. Do they have it at most testing sites, or is there specific sites we have to go to?
So I haven't seen it in every testing site. Some of the mobile sites I haven't seen it at. So I did ask the mobile sites. They didn't have it there, but I did have it at an H&H site, one of the permanent sites, that they have them.
So Maria, I have a question, like
Yeah, Leah.
besides the swab, yeah, thank you. Besides the swab and the, you know, antibody test, or the, I think that's the, like, you have to inject and take out the blood for the antibodies. Any other test you have
At this
besides the swab? Besides the swab, and no, right?
So we've got the rapid test. I've gotten the rapid test done. The rapid test is something that we got our results, I think, in 15 or 20 minutes. And then at the same time, when you get a rapid test, which is a short swab, they do that one and the other regular test. And the other test is more accurate, but it takes a little while. We were concerned because one of us had a cold. Luckily, that was all that it was. Everybody's better now, but we wanted to double check. And so it was negative after 20 minutes for the rapid test, and then it was negative again 2 days from that test. So, and then everybody got better. So that's really the goal, but that is how that's done.
So you draw the blood, right? For that, that's a lengthy one. Besides the swab, the extended one is you draw the blood?
No, the only one that I know that has drawn the blood is the antibody. So the antibody will take the blood. The rapid ones that I've seen, both from, and the diagnostic ones are both swabs.
Okay. There are some kids, including, of course, my kids, and Chris knows it. They don't want to wear face mask. How would these centers treat them? Which is very difficult, I know, but how to bring them if this is a situation where they refuse to wear face coverings? Would
I know
your
that-
staff be able to understand what the sensitivity is where?
so that's one of the things that I'm gonna find out, and that's a really, really good question, and I'm gonna write that down right now. So I can find out. I know that there are certain people that are exempt because they're not able to. So first off, anybody under 2, that's a very simple way to check. Are you under 2? That's an age thing. But then there are others that definitely, it's not as clear cut as a birthday. And so there is definitely that question. So I'm going to find out, but if they feel more comfortable, I know that Chris speaks about the
Face
face
shield.
guard. Yeah, the face shield. If they feel
Marina,
more
that was Debbie and
comfortable-
me. Both said face shields.
Okay.
I just
No, and nothing close to their face.
Yeah,
Just
and
like
I think that that's a big concern. So let me find out for that. And I'm also going to find out if there is some kind of, something else that can be done in that case. Yeah, I'll definitely look into that. And I'm going to make sure that Chris gets the answers for that as well.
Oh.
And Maria, just to add that, because Debbie mentioned it earlier, and I agree, and I actually agree with Lee, and I'm glad she brought it up also. There are some individuals who are low function and don't understand why they have to wear a mask.
Yeah.
right.
That's where the problem comes in. And I know Tina, as well as Aaliyah, as well as Debbie, will agree with me on this.
Mhm. Especially whether the problem is when they're usually under 18, the little children, most sites are pretty understanding. It's the problem when the older they get. And that's why I said,
The older-
that's why I brought up to the part of you, then they said, oh, stop with
Absolutely.
the baby. You know what? I'm sorry, they have a development ability. They're not doing this intentionally. They have tactile sensitivities. They just can't do it. If you think mom and dad doesn't want it, it's not because of that. It's to maintain sanity, because you don't want the kid then loses control. And they can't communicate by saying, no, I can't handle it. They'll start screaming because that's the only way they can communicate.
And that's when it comes into crisis. And
Yes.
then we have to deal with the crisis of that individual going nuts because they might think the mask is like someone who's a bad guy. The
Yeah.
only problem is that's the problem in the disability world, that low function
Or people with tactile
Sensitivity.
sensitivities, or we do also have individuals who have, I know we know someone who has, his arms are so short, they can't put a mask on independently, but they can get the face shield on independently. So we need to, we're asking, what can these sites do? That's why I asked you to ask these questions.
and we do appreciate
We
some of those.
appreciate. I know there's more you have to find out. We understand.
Well,
Yeah,
Right.
absolutely. And I'll find out, and I'll also see if there's certain protocol that the city as a whole takes into consideration, not just at these sites, but at school buildings and at other locations when they are interacting with, inside of municipal buildings, inside things like that, where they have to interact with folks that sometimes they may be nonverbal, they may just not be able to express what they need to express. And so I think that that's something that's incredibly important, and I could only think about how frustrating that is.
That's the right way to say it,
It is
Maria.
frustrating
You're
for
right.
us.
You're right. You're right on that button.
Yeah, and it's frustrating because that person can't communicate and can't explain what's wrong, and they can't, and so an individual, in whatever setting, in a hospital setting, anywhere else, it doesn't matter. They may not understand that that's a person that is nonverbal, or that that's a person. you know, unfortunately, there have been so many people who have tried to, you know, claim a disability. I have a breathing disability. I can't wear a mask, and then they're smoking cigarettes. So, I mean,
Right.
unfortunately, I've heard of that instance, and it has made me furious because for the people that actually do need accommodations,
Yes.
you're
That's
taking
right.
that away from those
Well
people.
said.
So so I mean, I'm very upset when it comes to those kind of
Right.
things.
So
And
say
so,
like, right. Well,
Um,
see, like my other son has autism, but
Mhm.
he wears face mask.
Mhm.
But my other son, he says, "What's going on? Why are you hiding your face?" So he just likes to, you know. So it
Mhm.
took us like 3 weeks at least to make him say that we have to cover our faces when we go out. But still, my older one doesn't want to wear the face mask, and we have really canceled 3 appointments for the dentist. So how to I wouldn't say educate, but how to make the staff aware that they have this tactile, like Deb said, situation where they just cannot, they cannot have anything on their face. Second thing is, if there is there any interpreter or a person who can translate if someone who cannot express their concern or ask a question in English, will there be an interpreter there at these sites?
So a lot of these sites, especially depending on what neighborhoods they're at, they have staff there that happen to be bilingual, trilingual, you know, anything like that. But if they can't speak a certain language, and let's say that you go to a site and they don't have a language that you need, they use Language Line, and that I think is 100 and I don't know, 30 or something. It's a vast amount of languages. So if there's
International
not someone
language.
like physically there that can do it, they will get an interpreter on the phone and then do it that way. But the Language Line has, I don't even know how many languages, but it has a tremendous amount of languages because we want to make sure that you understand what's going on and that they can understand what you need. So that's not a problem at
and
all.
Maria, I'm just gonna say, Leah, we're gonna let some people have some questions, and if Leah, if you have another question, hold that thought because you have some really good questions. But I want to have fun with some of these people who have been watching this. And
I have a question.
thank you, Sandy Naper.
Hi, Sandy.
Go ahead, Sandy.
How you doing, guys?
Fine.
Good, good. So I want to know, do you happen to know whether CityMD has the short swabs?
I'm not sure if they have the short swabs. I think I heard somebody that went there that had said that they got the short swabs, but that was a while back. That might mean that they still have them, which is great. I think that if more people are going towards the short swabs, then that's even better. But I haven't checked anytime too recently. If you do want to go to a CityMD, you can also give them a call. They might say that a particular time may be not as busy as a different time. And so that's the other good reason to call any of the private places, especially if something's going on and they have to close early or there's a situation or something like that. You never want to go all the way to a place. But I from the last I heard, they did have it, but it was a while back.
Okay, and one other question. Is the only place that you can get interpreters the HHS sites?
Some companies end up using them. The Language Line, I know that it's something that the city has to have, so that's not an option for the city to not have that. But a lot of big companies, they use that just because it would not benefit their business as a whole to not use that technology.
Thank you, Sandy.
Thank you, Sandy.
Thank you, Maria.
And let me check with anyone else has any questions. Because let's see, because we do have a telephone person. I'm gonna unmute her. Well, now we're playing mute button. Hello, 917.
Hello.
Hello. You can speak.
Let's see
917.
if they have a question.
That's what I did.
We're trying to see if they have it.
That's the question.
All right.
917-847-1724. Please identify yourself.
You
Hello?
may not want to.
Okay.
They're not answering.
Okay. If anyone's on the phone, remind them *6 is to unmute yourself. Anyone else has a question? Jackie, do you have a question?
Jackie T,
Jackie T?
I know you're there.
I'm here. I do not have any questions. I'm just listening. I did take my son for the test, and I have to say, while we were in the car, it was a challenge for him that, you know, he was not very happy. Obviously, we all need to do what we have to do, but it's just a matter of following through with what we need.
Yeah. If anybody really does not feel comfortable with getting a child that may need accommodations tested, first and foremost, you can also, when you get to a site, if you do want to take your child to be tested, you can speak with the person who's managing the line and just let them know that there are accommodations that you may need to have. They will take that into consideration. I've seen them do it when it came to a lot of people who are in like using walkers or things like that. And so you may be able to get pulled out of line and go first, because ultimately if you have somebody who is trying to do the right thing and they have some kind of block, whether it's a physical or mental block, you want to do everything that you can in order to accommodate and in order to make this something that they can go to, they can feel more comfortable. And so so that's one thing. But if you don't feel like you can have your child tested, but you feel like you can get tested yourself, that could be another option, because if you are in close proximity to your children, especially on a daily basis, there's a good chance that, you know, both of you might have it or both of you may not have it. And so, you know, not that we want everybody to have it, but that can be another option. As long as they're, you know, if they are showing symptoms, that's a different story, especially if they need additional medical assistance. But then unfortunately, if that does happen, they'd get it from a doctor and then they'd get tested when they get that additional assistance. So, but if anybody feels comfortable enough to take their child to a testing site, let the person who's managing the line, and there's always someone managing, let them know that you need an accommodation and they will work with you.
And that's something important too. Leah, before there's someone ahead of you, I want to make sure I get that person. Cindy from iPhone, your hand was up. And I just took your hand down.
Are you there, Cindy?
Cindy, you can unmute because you're on iPhone. iPhone. I am guessing if you can.
Hello?
Is there a question?
Okay. This is Cindy. This is Chris. You had your hand up. You have a question? Hello?
Hello?
You're off the mute. Can you?
You have a question.
Do you have a question? You, Cindy, iPhone.
Cindy's iPhone. Are you okay? Then we'll go on to the next person.
Okay. Then the next person's hand up is Aaliyah. Go ahead, Aaliyah.
I just have a question as to, is it possible we can get the PowerPoint in our emails?
Give me a copy of
Yeah.
the copy.
Yeah, Chris, if I send this to you, would you be able to send this out?
Sure.
Sure. That's not a problem because we're also recording this, so everybody will be able to rewatch it again.
And again.
And again.
Right.
Okay,
But
Leah, I have another question that's added into
Thank you,
this. You say, okay, the parent of a child with developmental ability is and because they have a senior parent living with them, the parent and the child with disability have to go to the hotel to be quarantined. But the child with a disability, developmental disability, does not know how to stay in the room and has no problem opening the door and running around. What kind of help or assistance will that family get?
So there's not a lot of people who take advantage of the hotel program because they feel more comfortable staying at home. A lot of children with disabilities, I'm sure that everybody on this call would know even better than I would, that there is a problem with change. And so if you feel more comfortable staying in your home, that's something that might be a better option. It's not that it's, we're telling you no, it's just, it may be a better option because that would be an added stress factor to the child. And so if it's just you and your child that you're home and you either become a contact or a case, then you can just stay in your own home and the city will make sure that the services that you need, the food, the medicine, laundry, things like that, within those 10 to 14 days, depending on where you are when you get called, that you can stay at home with that child. But if there is someone else in that home that can't, okay. So Sydney said they had a bad connection. That was
No problem, Will. But the other
yeah, but if that's the case, then they feel more comfortable staying at home. That may be a better option. Just because you want to take everything into consideration. You don't want to put an extra shock into anybody's system if you have the other option.
Yes, but one problem we have with the city with the food, they do not recognize food allergies at all. So
Okay.
our families who stayed home, example, cannot have anything that has soybean or like pea protein, and they give you tuna fish and salmon with pea protein. And then when you ask them not to do that, they say, I'm sorry, we don't recognize food allergies. Or people with diabetes, they give us stuff with sugar or sulfate.
Or something worse. Aaliyah, join me for a second. Because
They don't even
hold
follow-
on.
yeah.
Let me
You
see.
can find out. Oh well, you can definitely see if you can get groceries.
Yeah, but
Instead
Maria,
of
Maria, that's not the issue.
meals.
that's not the
The
issue.
food is sent to you from New York City, and they finally recognize halal to a point. They recognize kosher, but they do not recognize food allergies. And you can make it very simple, and they won't. So please take that back to your
And
board.
Marie, let me
I'll let the Get Food team know that flag. I know that that's an issue that they've been having because they have only certain things. They try to make all of the meals sodium, like very light on sodium, because most of the people that are getting to Get Food are seniors, and they try to have that as one of the things that all the meals have as a requirement, low sodium. But besides that, besides the halal, kosher, and vegetarian, not vegan, but vegetarian options, that's pretty much the only things that are different from a regular.
They're
Maria,
not meeting the people's dietary needs.
Maria, there's one other thing also. There are some things like Leah will vouch with me as well, because this has been going on in Queens as well. And I will say, Tina, you as well also had that issue, is some of our individuals have to go on a soft diet.
Mhm.
They don't accommodate that. And there's individuals out there, and I know Leah's going to chime in also on this as well as Tina. We have individuals not in a group home or in a group home cannot eat solid food. They have to eat, everything has to be, mush, salt, puree, really soft.
They don't recognize that.
Yeah.
No matter how much documentation we give.
Am I right?
I'll note it for the food
Absolutely
team.
right. Absolutely.
They don't even, but please also tell them to acknowledge the food allergies too.
Yeah, no, I'm putting both down.
Thank you.
And that's why I just said I need to chime in.
The question is, would people that have the food allergies or that require soft food benefit from groceries versus ready-made meals, or would they still be needing ready-made meals?
You can do at times ready-made meals, but like if you tell them, example, I don't want to see peas, I don't want to see green beans. I gave you the basic vegetables. You can give me corn, carrots, zucchini, broccoli, cauliflower. That's it. I don't care. When it comes
I
to
think that the wraparound service for people who are isolating may be a different kind of option. So I can check with them.
because I'm going to tell you that so many of us have to do, but the best one is they send us canned foods with stuff we're allergic to in them. It's specifically, we gave them the brand name of what we're allowed, and a lot of times it's just generic brand from the store that we deal with, and we've asked them. They don't want to hear us.
Okay, I'm gonna find out from the Take Care team what that means when they give the food, and if that's different than the Get Food team's ready-made packages.
Okay,
So I'll find out, absolutely.
thank you.
PHP, you had your hand up earlier.
Hello,
Reeves, like Reyes,
Reyes.
J, PHP, and then you're off the mute.
Hello,
Hello.
you have Maria here. Ask a question.
Okay. Gonna remind everyone, if you have a question or you're just listening, that's fine, but it's not, Marie doesn't bite.
She's very.
Am I right, Marie? You don't bite.
No,
No.
not at all.
Now Maria,
And I said that on live. So
and Maria always, and I know Maria because she's my liaison to my local community board, that I am a member, and when I have questions or concerns and I bring it to her, she listens, takes it down, and does try to get back to me with the best answer, and she does try to, and she does the best to advocate with me to make the positive changes.
well,
Thank you for those kind words.
well,
You're welcome, my dear.
I have to say the hands up system must be working because Leah, go ahead,
Go ahead, Leah.
and Tina, do you have a question also after Leah?
No, I'm good, thank you.
Of course you could. You're Tina from the
You're
Bronx.
wonderful, Tina. We love you.
I always have questions, right?
Go ahead.
It's not a question, is just a suggestion, not a question, I would say. Since I see our wonderful Jackie Tripodi, so it just came in my mind that, how are you? So it came in my mind that family reimbursement should also cover the mask, face mask and sanitizers, or at least alcohol, rubbing alcohol. We have to work with Deb and get some kind of approval from OPWDD, because it's when the face mask is actually care coordinators are. I mean, my son's care coordinator gave it to the staff. So there should be a way that parents could get it, because it's now no longer a luxury; it's a necessity.
Yeah.
And
There-
you can answer
There
that.
are some giveaways. I know that in different locations. I know Chris talked about at the subway station. Right now, they're in specific areas, specifically where it's red and yellow clusters. And now it's going to be I'm sure it's going to be in other parts of the city. You may see city inspectors that you may not necessarily, they might look out of place. So somebody that's from DOT or from the Taxi and Limousine Commission are going into, restaurants. And so the reason is that we have inspectors from multiple agencies that are going out. They're doing education. They're, in some cases, unfortunately, they are issuing violations for businesses that are non-compliant. They also carry with them masks. I know because I supplied them with masks. And so they have masks available. In other locations, I know that we try to work with different groups. Some we were able to get masks out and they're already gone. I mean, people do these distributions and they're gone so quickly. If you go to a testing site or you pass by a mobile site or something of that sort, you can always ask for a mask. They should be able to help you.
Actually, right. I'm actually talking about the special needs population, because they have a sensitivity to cloth, which is reusable face covers. So there should be a way, but that has to be coming from OPWDD. I'm talking about family reimbursements for the mask and for the sanitizers.
Good
So
luck.
that is not that I know, because in our neighborhood, we there are some sites which give the face covers, but this is like a reimbursement. Like if a family buys it, we can,
Leah,
this
can I
is the
ask you a question? Do you have a supplier that brings you other supplies? Did you ever try to get the stuff from them? You might get it from your health insurance.
no, they don't.
They don't do that? Okay.
Well, we do have.
That's why that could be family reimbursement.
Leah, we do have two agents. Jackie wants to answer that question. Jackie?
And Leah,
Go
so
ahead.
the issue with the PPE is that just like Maria said, you can get face masks free from different city agencies. So the state isn't going to reimburse for that
Okay.
type of PPE.
I see.
That being said, we can help with reimbursement of clothing. Now today, I don't know, the other day I went to Walmart and I was able to buy face mask and it was in with my clothing reimbursement.
Oh, really? Okay.
I
Sure,
purchased, just hear me. Are you hearing?
Yes.
If you
Yeah.
make, we cannot reimburse for PPE, especially if it's given for free. When an individual or family member needs to go clothes shopping, now in Queens, the Bronx, I would very much like to say hi to Tina because I don't think we've ever met and would very much love to touch base with you. Chris, Deborah, we've had conversations before.
Yes, we have.
We are able to reimburse for clothing now up to $500 in the 5 boroughs. In the past, it's only been like $250. Now, because of things that are going on, we're able to help families. When families are purchasing reusable masks as clothing, it's part of a clothing reimbursement. That can be, we can get that in to help families. If you're buying disposable face masks, this is not something that we can help with the reimbursement because you can get it from the city for free. So the state isn't going to authorize a payment that you can get something for free. Just like if it's paid for by Medicaid, we can't help reimburse for it. The cleaning, like alcohol and stuff, that can be purchased through Medicaid. A family can get that through, if it can be paid for through Medicaid, we cannot use family support reimbursement dollars for it.
And also, I just want to clarify also one thing important, Maria, you should know this. When we say family support dollars, that means our children must be living at home with us and not going into a residential setting. If they do, they are not qualified for family support reimbursement. Am I correct, Jackie?
That is absolutely correct. Families who have their individuals who live at home with them and have OPWDD eligibility can qualify and be eligible for family reimbursement. Keeping in mind, family reimbursement is never guaranteed. It is subject to committee approval and state approval for eligibility. If you're looking to get reimbursed for something, say a queen size bed, I actually had another borough deny a queen size bed even with a medical justification. So nothing is guaranteed. But in answer to, I understand where you're coming from, Aaliyah, because families have had to go out and purchase things. Like I said, I bought, masks for my own son. He does live in a residence. I wouldn't qualify for family reimbursement. That's irrelevant. But because I can call 311 and find out where the city is giving them, this is not something that we can do as a reimbursement. But there are other ways that we could help the families through family reimbursement.
And Aaliyah, as much as I would love this, and so would probably Tina, there are certain regulations that we just can't get around.
But with
And
the,
it's because it also, there's one more thing. The New York State Department of Budget, as well as the New York State Controller's Office, oversees and looks at every type of reimbursement OPWD offers to the families living at home. So we have to make sure that trust me, I would prefer, but I will tell you though, I was went to go shopping at a supermarket, and the fire department handed my cousin and one package of masks. But me, she looks at me. Now my walker is a walker, and she, oh, you must live with a big family, right? Sure. I got 2 packs.
We got some people have questions.
So we can also get, but Jackie, thank you so much for clarifying everything. We appreciate it.
And nice meeting you, Jackie. We hope to work with you soon.
Okay.
It's Tina.
Tina from the Bronx.
Yeah, it's Tina, Jackie.
Thank Maria.
If I could, Chris, I did put my information in the chat. Tina, I would love if we can get some information because the Bronx, Queens, Aaliyah, we presented there. You guys are fabulous. In Brooklyn, you know, thank you for being so accommodating to let us get this information out. The testing is so important, and I have to say, when we did go, I just want to go back to the whole testing. They were very, very kind to my son. Just so that you know, Mary, when we went, Joseph gave a big struggle, and they were very, very patient. So and he's 27. He's no lightweight. So just know that they were very helpful when we went. And thank you.
That's very good to know. That's very positive to know. Thank you.
Maria, there is a question that has came up. And this is something for the agencies who are in this here now, because this is something very important. Because I know that some agencies are doing it, but there are some agencies are not doing it.
It's like I got a lot of information from.
Guys, hello.
Oh, okay, you got it. Okay.
We're back.
We're back.
What is-
Okay, guys, we gotta have one microphone on because it's too much.
It's acting up.
It's gonna go to overload then.
Maria, can you hear us?
Okay, Maria.
Yeah, I can.
Okay. The main question is, and I thank my other borough advisory councils backing up
For their help.
their help on this one. But this is the one question for all the agencies in this end. Corona, how can we, and I will say we, it's not just us, but the agencies as well, can do a Corona-19 site, not just at the clinics, but at indoor sites. Can you explain that?
Yeah, absolutely. So first and foremost, if you have a location that would like to participate in doing a microsite, you can send me an email. I'll send you the specific language as to what they need. Essentially, I'll just say it quickly. I know this morning I went into a little bit more detail, but what they need is they need a staffer that's going to be there from the moment that they get there to the moment that they leave. So that's 9:30 until 3:30 or 4:30. I can double check to see that, but yeah, so they have to be there. If you have an indoor site, that's better because the weather is getting worse. If you only have an outdoor site but you have an option to go indoors, if the weather does get bad, that would be really great. You need to provide at least 2 chairs and 1 table. If you have a space that they can leave their PPE and other cleaning supplies, because they are the ones that will be disinfecting everything. If you've got a place for them to be able to store it, because if they're going to be there for the entire week, it makes it easier to just leave it in a particular room or wherever it is. So that is one of the requirements. And then there's a simple form. If you feel like you have a location that can accommodate, I can't guarantee that every location is going to be chosen. If there's an H&H site, like a physical site across the street from you, you're not going to get chosen because people can just walk across the street. But I did ask them earlier today if we can have some of the different clinics that are used to, I think it was an article, there were 2 numbers. Is it
and 28.
Yes. So I asked if those sites can get testing supplies because they're not dealing with the same kind of population necessarily, and they may be more sensitive and they may be able to accommodate parents and their children a lot better than some of the other sites. So I have taken that in and I asked them if there could be more of those sites, but also if you've got a particular location that you yourself may not be a medical professional, but you would like just a location that's more central, maybe around a location that has, you know, different services, different schools, things like that, then please send me an email. I'll send you all the specifics as to what's requested. And then there's a form if you feel that you can, in fact, accommodate. They're asking for very few things, but they are focusing definitely on the cluster areas, but not just, because we do have Staten Island and Bronx sites right now.
Thank you, Maria.
That's great to know, Maria. But also, Maria, one thing, we may have one or two of our agencies are near an H&H site. And yes, the H&H sites do not always serve our population because they're also not accessible. And one other suggestion I didn't bring up this morning, maybe we should join with the mayor's office of persons with disabilities, as they are very in tune to try to see that our population and other population people with different disabilities can be served in a truly accessible and patient site.
Okay. No, that's very fair. And I'm not saying that it's a definite no, it's just that that's kind of where they're trying to do. So, but they take a lot of things into consideration.
I understand that. I just wanted to say that because I do know in certain parts of the city, there are our Article 28 clinics that are very close to the H&H site, but the H&H don't always serve our population, as well as other disabilities, because our children may have a disability, but the families may have all their own disabilities too.
Since no one else has any other questions,
Tina or
Leah,
do you have anything you'd like to say?
Leah changed the queue. Leah and Tina, can you unmute yourselves?
Well, you know, as always, I just wanted to say thank you to everybody that attended. Thank you for the information.
Yeah.
And I appreciate all that came. And I thank Ms. Maria Mark for taking the time out of her day to do it today and this evening.
Absolutely. Thank you.
I also thank you, and I just have a quick question which I typed for Miss Jackie Tripodi. When is the quarter ending? When is the quarter ending for the reimbursements? I have to tell this to my group, so that's why.
Well, I have to just say, we accept applications throughout the whole fiscal year. It's not based on the quarter. Some other agencies, they do it per quarter. NYSED does not. NYSED does it throughout the whole fiscal year. So if you have receipts from July through now, we'll accept them. If you submit an application to us in January and the receipts are from July, we'll accept them. But you only get one reimbursement from NYSED. Other agencies do it quarterly, and
they do
put so many through a time. But for NYSED, it's one reimbursement per fiscal year. So as long as the receipt is dated within the fiscal year, it's irrelevant to the quarter. Our quarter will end in December, in answer to your question, but that doesn't mean that you have to submit a reimbursement then.
Remember also, Aaliyah, and please, we're letting everybody else know, New York City is on a different fiscal year than the rest of New York State. That means Nassau and Suffolk County are not on the same fiscal year, as well as Westchester, Rockland, the rest of the state. New York City is July 1st to June 30th. That's our fiscal year. The state is April 1st to March 31st. Just want to clarify it for people who do not understand what we're saying.
So,
well, wait, Deborah. For the state, for family reimbursement, it's July 1st to June 30th.
That's what she said.
No, New York City, we're July 1st to June 30th. But outside of New York City, it is April 1st to March 31st.
That's the city, not OPWDD.
Yeah. We, New York City, are in a totally different fiscal year than the rest of the state.
Yeah, but OPW is July. OPWDD is July.
We're talking about OPWDD budgets in fiscal year for New York City is different than the fiscal year for the rest of the state. Okay.
I think everyone got some good information today. I do want to
Thank
thank
you.
Brooklyn. I'm Brooklyn, so I'm sorry.
That's
Bronx,
it.
Thank you, sir.
Bronx, Queens Advisory Council Chair, statewide members. I want to thank you guys.
You're
But
welcome.
special thanks goes to Maria Mark.
Mark, we want to thank
Thank
you.
you.
Yay.
Yeah, if
Your
you're gonna,
help.
Maria, if you're gonna start
Thank
crying
you.
again, do it out. You don't have to do it. Outside's doing it.
But we appreciate, Maria, you've been very helpful. and
Very
informative.
good, yeah.
Thank you. Thank you so much. I'm trying to see if there's anything. I just got an email. If there's anything,
Yeah.
no.
Just to let everyone know, and I know
Thank
people
you
are writing
so
on
much.
chats, which I thank everyone writing the chats. But to remind everyone, please make sure that in the beginning you saw, please you can contact your borough advisory councils. They're in the 5 boroughs and the 19 counties. Please make sure you visit them. And I will say this, please always make sure you wear a mask on the train, the bus, Accessorize, Long Island Railroad, Metro North. If you don't, and the cops catches you, first they would ask you to put on a mask. If not, it's a $50 fine. If you prove them, show them that the person has a disability, you will not get the fine. They will just make sure to help you the best they can. Again, thank you everyone, and have a great evening. And don't forget to go vote.
Thank you, everybody.
Thank you,
Have a good
everybody.
evening, everyone. Be well.
Thank you so much, everyone.